What is a chemical stress test? If you or a loved one has been recommended for a chemical stress test, you might be wondering what this procedure is all about. Let's break it down step by step. A chemical stress test, also known as a pharmacologic stress test, is a medical procedure used to evaluate how your heart functions under stress, but without the need for physical exercise. This test is particularly useful when a patient cannot perform a traditional exercise stress test on a treadmill or stationary bicycle due to a medical condition. Here's how it works. During the test, a medication is administered through an intravenous line to simulate the effects of exercise on your heart. Common medications used include adenosine, dipyridamole, and regadenoson. These drugs cause your heart rate to increase and your blood vessels to dilate, mimicking the physiological effects of physical exertion. Before the test begins, you may undergo a brief physical exam, which includes checking your blood pressure and performing an electrocardiogram, ECG, to record your heart's rhythm. Electrodes will be placed on your skin for the ECG, and you will be attached to a heart monitor to continuously assess your heart function. Once the medication is injected into your IV, you might feel symptoms similar to those you would experience during exercise, such as a faster heart rate, shortness of breath, flushing, or chest discomfort. These sensations are temporary and typically subside once the medication wears off. Throughout the test, a team of medical professionals will closely monitor your vital signs and heart rhythm. If you experience any uncomfortable side effects, such as chest pain or difficulty breathing, the test can be stopped immediately. The imaging portion of the test can involve either an echocardiogram, which uses sound waves to create images of your heart, or isotope imaging, where a small amount of a radioactive substance is used to visualize blood flow through your heart. These images are taken before and after the administration of the stress-producing medication to compare how your heart functions under different conditions. A chemical stress test can help doctors diagnose various heart conditions, including coronary artery disease, heart failure, heart valve disease, and arrhythmias. It provides valuable information on how well your heart pumps blood and whether there are any blockages or issues with your heart's functioning. After the test, you will be monitored in a recovery area where you will be given water, snacks, and possibly caffeine to help alleviate any remaining symptoms. The entire process, from preparation to recovery, typically takes about 2 to 4 hours. It's important to note that while a chemical stress test is generally safe, there are some rare risks involved, such as triggering an arrhythmia or, very rarely, a heart attack. However, these risks are closely monitored and managed by the healthcare team. Preparing for the test involves avoiding caffeine for 24 hours prior and consuming only water in the 4 hours leading up to the test. Your doctor will also review any medications you are currently taking to ensure they do not interfere with the test. In summary, a chemical stress test is a safe and effective way to assess your heart's health when physical exercise is not an option, providing crucial information to help your doctor diagnose and manage heart conditions.